Good afternoon. My name is Jasmine Blue. Thank you so much for being here with me today. We're going to go ahead and break down the diagnostic presentation of Gabriela Perez. We'll be breaking this down into 5 parts. Part 1, preparation for engagement. Part 2, comprehensive assessment and diagnosis. Part 3, critical analysis of evidence-based treatment approaches. Part 4, evaluation plan and tool instruments used. Then lastly, Part 5, implications for practice. All right, let's begin. Part 1, preparation for engagement. Gabriela Perez is a 15-year-old Hispanic female that presented to a children's psychiatrist after being referred by her school counselor. Gabriela reported being very sad all the time and wanting to hide in a hole and never come out. The school counselor and Gabriela's mother reported that over the past few months, Gabriela has noticeably been in an irritable and depressed mood, as well as avoiding her friends and struggling in classes at school. Gabriela reports feeling distracted and uninterested with the material. Instead, she spends her time in class drawing pictures of nooses and the Grim Reaper on her notebooks. When asked if she was having thoughts of suicide, Gabriela avoided eye contact and shrugged her shoulders, stating, "I guess, but who doesn't?" Gabriela's mother reported that she hasn't been eating very much and has been sleeping a lot at home. When Gabriela's mother attempts to go into her room or to talk with her, she yells and cries and tells her mother to go away. Which leads me to Part 2, comprehensive assessment and diagnosis. Gabriela is the oldest of 2 kids. She lives with her 11-year-old brother and her mother in an apartment on the east side of town. Her father struggled with depression for most of his life and committed suicide when she was just 10. Her mother never remarried and doesn't date, claiming she's too busy. Her mother works at a gas station on the weekdays and works doubles at Burger King on the weekends. So we can tell that there's not a whole lot of supervision in the house. It sounds like Gabriela and her brother are just kind of left to fend for themselves for the most part, most days. Gabriela's mother describes her as having a normal childhood, growing up a happy girl that loved to be active outside and play with her friends after school. Gabriela is well liked and social at school and a good student, averaging A's and B's with a passion for science and history. She has no history of any medical problems and denies any drug or alcohol use. During an interview, Gabriela denied experiencing any hallucinations or delusions. Her mother reports she has never witnessed this behavior in her daughter before. Okay. So, according to the DSM-5, Gabriela meets the criteria for major depressive disorder, severe, single episode. From what we can see from her history, her psychosocial, and as well as her current symptoms, she meets 5 or more of the diagnostic criteria. Mood disorder due to another medical condition could be considered, as well as substance medication-induced depressive disorder if her substance use report was false. From what is known, they don't account for all of her symptoms. However, further testing and monitoring would need to be done to be sure and rule out these possibilities. Which leads me to Part 3, critical analysis of evidence-based treatment approaches. There are many different interventions that could be used for major depressive disorder with adolescents, and a few that I've named that I felt would be best in this situation would be interpersonal psychotherapy, family-based therapy, cognitive behavioral therapy, antidepressant medications, and then stepped care interpersonal psychotherapy treatment for adolescents. So I'll go ahead and break all those down. First intervention type would be interpersonal psychotherapy for depressed adolescents, also known as IPTA. This is found to be an acceptable form of treatment for depressed Latino adolescents treated in pediatric primary care clinics serving minority families. IPTA is described as a culturally responsive psychotherapy that may be effective with Latino youth due to its consistency with Latino family values. So just doing one-on-one, client-based, interpersonal psychotherapy would be beneficial for her. Second intervention type would be family-based therapy. Research found in the Journal of Abnormal Child Psychology that it suggests that non-affective features of families, such as the amount of time parents and adolescents spend together, affect depressive symptoms in adolescents. As we can see, Gabriella's mother is working quite often. She has a busy work schedule, so she doesn't get to spend a lot of time with her children. And when she does, it sounds as though Gabriella sticks to herself for the most part. The use of psychotherapy with parents as an intervention focuses on increasing parental support, improving communication, and reducing conflict. Having family support and involvement, as well as a family-focused routine, such as having dinner together, has been found to lessen depressive symptoms in adolescents. I believe that the use of a family-based approach might benefit her, especially if right now, her mom isn't quite in the picture. She doesn't have a father in the picture. She might be feeling very alone, very isolated. My next intervention type would be cognitive behavioral therapy, or CBT. CBT can be used to teach clients to recognize and overcome patterns of negative thoughts and behaviors, and has been found to be effective with adolescents with major depressive disorder. Several comparative outcome trials have indicated that CBT is just as effective as antidepressant medications at alleviating clinically significant depressive symptoms. Which leads me to my next intervention type, antidepressant medications. Selective serotonin reuptake inhibitor SSRI medications, such as fluoxetine and escitalopram, are frequently used to treat adolescent depression and are found effective. And then lastly, my suggested treatment type would be the stepped care interpersonal psychotherapy treatment for adolescents, also known as SCIPTA. It's a collaborative care treatment model for adolescents with depression utilizing interpersonal psychotherapy for adolescents, IPTA, and antidepressant medications as needed. So it's just kind of a mixed methods approach. Which leads me to part 4, evaluation plan and the different tools and instruments used to help Gabriella Perez. So we decided we would use the stepped care interpersonal psychotherapy treatment for adolescents, SCIPTA, and SSRI medications. SCIPTA is a 20-week program delivered in a pediatric clinic by clinic staff that spans over 2 phases. This program uses IPTA and medication management to lessen the depressive symptoms and help the adolescent develop better ways to communicate and problem solve, as well as improve family functioning. The primary concepts of SCIPTA are developing better ways to communicate and problem solve within significant relationships by focusing on 1 or 2 of the 4 problem areas at one time. So by breaking it up into different, subcategories. Then there's psychoeducation about depression, psychoeducation about antidepressants, collecting in an abbreviated interpersonal inventory review of significant relationships, teaching communication and problem-solving skills, and then relapse prevention through the identification of warning signs. In this case, Gabriella would participate in this program individually, and then her mom would receive psychoeducation afterwards. However, when the program is ended and they believe that family therapy would be beneficial, they could consider it. This program, however, would be of assistance with her mother's busy work schedule and their socioeconomic status right now of her trying to keep up on the bills. Gabriella would be started on an SSRI medication and she would be monitored. Her medications would be altered as seen fit. If the participant could not tolerate fluoxetine, or if there was a clinical indication to use a different SSRI, then it is possible to start with or switch to a different medication. Treatment goals are to decrease symptoms of depression as well as suicidal ideation, and increase communication and problem-solving skills, as well as identify triggers and learn to cope through feelings of depression and hopelessness. The objectives are measurable in the time frame allowed for SCIPTA. If things go as planned, Gabriella's grades and attendance should improve, and then her once desired hobbies will become desirable yet again. She will sleep less and eat more, improving her overall physical health. Assessment tools for Gabriella's case were personal interviews from Gabriella, her mother, her teacher and school counselor, the Children's Depression Rating Scale revised, so the CDRSR, the Patient Health Questionnaire, the PHQ-9, the Clinical Global Impression Scale, the CGIS, and the Children's Global Assessment Scale, CGAS. All these can be done before, during, and after treatment to determine intervention effectiveness. Which leads us to Part 5, Implications for Practice. The information learned about this study will be useful in our practice. The use of a mixed methods approach to treating a disorder is very beneficial. There's still so much to be learned about treating adolescents with different disabilities and different disorders. However, it was helpful learning about the different interventions used for major depressive disorder for adolescents. It will be important to consider the different cultural diversity issues of the client. Some cultural diversity issues identified for Gabriella are her Hispanic culture, the family's low economic status, and lack of supervision. This social worker will need to be aware of Gabriella's cultural norms, as well as her economic status when assessing what can be done to help her and her family. It'll be important to make sure that, especially the economic status, her insurance will be covering the different intervention types used. And then it will also be able to make sure that her mother, because she is in a single parent household, will be able to attend and be able to, work with those different interventions. It will also be important, the social worker must keep in mind that Gabriella has potential to be a high-risk case. We need to monitor her suicidal ideation, as well as develop a possible safety plan for Gabriella. The safety plan could identify the possible warning signs a crisis may be developing, possible triggers, coping skills, phone numbers and addresses of clinics and counselors, and then people in the community, friends, friends of the family, neighbors, to reach out to, and then completed with the suicide helpline. It would be helpful to educate the family on her safety plan so they know what warning signs to look for, and phone numbers to call if something were to happen to Gabriella. Basically, to have a plan. If the social worker thought Gabriella to be a harm to herself or others, a psychiatric consult might be considered for Gabriella. So, that leads me to my conclusion. We have broken down this case into 5 different steps, into 5 parts: preparation for engagement, comprehensive assessment and diagnosis, critical analysis of evidence-based treatment approaches, evaluation plan and the different tools and instruments used, and then the implications for practice.